Good morning, good afternoon, and good evening. Welcome to the continuous and uninterrupted Zoom session of IFPH Day 855. Today we have with us Dr. Gurukiran, BHMS SCPH, have graduated from BHMS from Government Homeopathy Medical College and Hospital, Bangalore, affiliated to Rajiv Gandhi University of Health Sciences. Classical homeopathic practitioner in the district of Chamarajanagar in Karnataka, India. 14 years of clinical experience and independent researcher. Post-graduation fellowship in SCPH, International Center for Homeopathy Medicine, United Nations. Presented papers in homeopathic approach for the treatment of different types of cases, especially psoriasis, thyroid, PCOS, epilepsy, hypertension, respiratory disorders, parahemophilia, GERD, alopecia areata, and infertility. Presented papers in Doordarshan, that is a national channel, television channel of India. The subject is Homeopathic Clinical Insights, Pathological Cases. We heard a lot from Dr. Gurukiran and all proved very effective and really wonderful and fascinating one. So on behalf of IFPH, I am welcoming you, Doctor. You can have the platform for the next 40 minutes or two.
Welcome to the today's sessions of IFPH. I'm happy for this session today because I'm presenting on pathological cases. It is very, very interesting, pathological cases, and we encounter a lot of pathological cases in our daily practices. So that was today's topic, Homeopathic Clinical Insights, Pathological Cases. Yes. Before that, I would like to show Dr. Samuel Hahnemann in our post stamp of India, which is of 1977, a 2 rupees stamp. In that time, the Hahnemann logo was stamped in a 2 rupees stamp. A big bow to the Dr. Samuel Hahnemann. Because of him, we are all here. Yes, when we speak pathological cases, we should not forget Dr. Boger, Dr. Cyrus Maxwell Boger. He is one of the finest prescriber of his time when he was practicing. Dr. Boger was specifically treating a lot of pathological cases, and he was a master in treating pathological cases. So when we consider presenting a pathological case, we cannot forget Dr. Boger and his works and his contribution from literature and from his practice to the homeopathic field. He was very well known doctor at his time. He was practicing in US, and he was very popular to his in depth of knowledge in materia medica, philosophy, case taking, repertory, and prescribing. And especially the prescribing, he was inimitable and exemplary at his times. Then we should not forget Dr. Virchow, era of cellular pathology. It was in 1821 to 1902. Dr. Rudolf Virchow. He has contributed a lot to the pathology. And Dr. J. Kirkpatrick of MD, in a discussion, he says, one of the fortunate things for homeopathy is the cellular pathology of Virchow and modern writers. That's why I have shown the photograph of Virchow. Modern pathologists are not content to look upon a case in gross or in large way. They take microscope and examine the constitution of the diseased cell and chemically analyze the changes in the cell substance, but they cannot reach infinite. This is his discussion. They are forced to acknowledge as the unknowable. Regarding homeopathy, with its drug provings, is the only way to rationally reach the living cell, and in their observation, at least to the extent of furnishing something of scientific explanation for its workings. See, that is where we play a major role as a homeopath by drug provings. A complete diagnosis offers a full comprehension of the patient's personality, his constitution, and mechanism of production of the symptoms, both subjective and objective. It gives an idea of the locations, especially tissues and organs affected, the pathological changes, the pathogenetic agent, the physiological disturbances induced in the pathogenesis. No responsible person engaged in the art of healing could afford to ignore this gold mine. So pathology is very, very important in cases. So location in pathological generals. Very often in an acute case, the location helps considerably in the prescription. This is a very, very small example, what we face in our daily practice. In one instance of high fever, the location of tonsils helped in prescribing mercurius in the absence of any other characteristic symptom. The fever was 104 degrees Fahrenheit, was brought down to normal in the next day after proper diagnosis of tonsillitis. This is where the pathological prescription helps. This is where the pathology of knowledge is very, very important to the homeopaths, where we can diagnose the cases. The knowledge of diagnostic symptoms helps in determining the individual characteristic symptoms, in which form the basis of a prescription in homeopathic practice according to the concept of totality of symptoms. It also enables the physicians to choose his case and to eliminate cases requiring primarily surgical or other measures. And pathological prescriptions, by giving information about the locations and the nature of pathological changes present, that is called the pathological generals. So this is very, very important. So knowledge of pathology, this is where it helps. Enables the physician to choose his case and to eliminate cases requiring primarily surgical or other measures. It aids prescription by giving information about the locations and nature of pathological changes present. It determines the pathological changes are far advanced and have affected any of the vital organs. If they are, the following measures are contraindicated. This is very, very important. What are the contraindications? See, let me see the contraindications. Use of deep acting constitutional remedies like silicea, lycopodium, sulfur, etc. is contraindicated in deep pathological cases. We should be well aware before using these remedies. Unless the case is prepared beforehand by the administration of a superficially acting related remedy. Use of high potencies. In pathological cases, there is no role of high potencies. Frequent repetition of similar deep acting remedy. Sometimes a dose of a remedy like phosphorus 30 may be required once in every 3 to 4 months. So the patience is very, very important here in treating pathological cases. And keen observation and the pathological changes which properly progress in the cases. So these are all the basic thing I wanted to say for the today's session about the pathological generals, about the pathological conditions, what we can do as a homeopath. Let's move on to the cases. So first case, it's a case of appendicular wall thickening. As we all know, we have treated a lot of appendicitis cases. This is a case of appendicular wall thickening. Let me see what it is. A female aged about 29 years was presented with a pain in the lower quadrant of the abdomen since 1 month. It's a chronic condition, pathologically involved. She was suffering since 1 month. She was diagnosed with appendicular wall thickening after the ultrasound scanning, and the patient was advised for surgery. Some medicines was prescribed to her. She was taking that. After hearing with some friends, they have suggested that you can opt for a homeopathic treatment. Then she came to me. The patient was in a dilemma whether to opt for a surgery or for the homeopathic treatment. She asked me, sir, what can we do in this case? Is it curable? Can you treat my case, or shall I go for surgery? The surgeons have properly advised me to go for a surgery. That's all. There is no treatment option here. We have to opt for in surgery. So I took the case, and I regularly, according to homeopathic case taking, all the details I have not mentioned here. Only the main points I have mentioned in today. So the patient was having the pain in abdomen, especially the pain was aggravated by movement, and the patient was thirsty, and the patient was having constipation. So this was the ultrasound report of the patient, which he presented to me in my clinic. See the impression, which is appendicular wall thickening without surrounding any inflammation. Appendicular wall of thickened, there is no evidence of periappendicular inflammation. Appendix measures about 6 mm in diameter. So this was the presenting complaint. So after case taking, according to homeopathy, the rubrics which I selected was abdomen pain. The abdomen pain which was aggravated by movement. The patient was thirsty. The patient is constipated. So these are all the presenting complaints what she has given to me. Then repertorizing the rubrics: pain abdomen, aggravation by movement, patient is thirsty, patient is constipated. So the leading remedy is Brownia. The totality which is covered is Brownia, 13 marks. Symptoms covered, all the 4. So after that, this is the Brownia. 200, 2 doses for 15 days. Since it is in syphilitic thing, most of my cases in my clinic, when I consider the miasm which is syphilitic in nature, I tend to prescribe 200 potency. If it is not, there is a psychotic background, I tend to prescribe 30 potencies, especially in pathology. I'm only speaking on pathological cases. So after 1 month, the patient came with a report. No significant abnormality detected. Patient got better by 15 days. Firstly, the physical generals was improved well. The constipation reduced. The pain gradually got down, and she was better by movement and all. There was no aggravations. The patient have to have his routine daily activities after taking the treatment for 1 month. And one more dose I have prescribed after that. After 1 month of scan, impression is no significant abnormality detected. There is no evidence of enlarged inflamed appendix. There is no intraperitoneal inflammation. This was the report. Let's move on to the next case. It's a case of varicose ulcer. These are a very complicated case. Varicose ulcers, what we encounter in the daily practice. This was a female, aged about 40 years, presented with the case of varicose ulcer on the left leg since 4 years. Actually, this patient, she was working in a hospital. Painful with discharge from the wound, which is thin and watery. History of varicose veins since 10 years. She has undergone surgery once. Started with the varicose vein started with the right leg. Now the problem is in the left leg. History of headache, which is aggravated to sun exposure. The patient is having wheezing since 10 years, which is aggravated to allergic bronchitis. Past history of bronchitis started in the teenage. History of jaundice 10 years back. Family history, there is a family history of varicose veins in her father. Diet is mixed, appetite and hunger is good. Desire for hot food and hot drinks. Sweat profuse after exertion. Thermally, the patient is hot. Physical makeup of the patient is very lean, thin and long necked. When you observe some patients, there is the body will throw some of the characteristic symptoms. We should be able to catch the characteristic symptom. The patient was having long neck when compared to other people. This becomes a characteristic in choosing the remedy. the mentals of the patient. She is an extroverted, having good morals, and intellectually she is good. She is a nun. She is duty conscious. She goes for the prayer regularly. She is very industrious, wants discipline in everything, doesn't like to travel much. She is restless. She wants to work always. She has to be busy, and she is very diligent, conscientious and diligent. No interest in wearing ornaments. Also, before she would like to become a nun from the teenage. And soberness. Anger is expressed. Less emotional. Cannot support injustice in any way, and wants to do some sort of service to the mankind. This was his basic mental picture of the patient. So after this detailed case taking, this was the first picture of the patient, the varicose ulcer of the left leg, having some discharge. The observation is very, very important in this case. See the thickness of the leg at the first photograph with the varicose ulcer having some discharge. Okay. Then after the detailed case taking, I have made a totality considering she is an extrovert, she is a duty conscious, industrious, disciplined, doesn't like to travel much, very conscientious and diligent, restless, sober. So these are all the totality of symptoms. Less emotional to herself. Anger is the only thing which is expressed. Long neck. Thermals, patient is hot. I would like to present this case. I have not done the repertory for this case because the patient picture is very clear, very clear. After seeing this case, I thought of some remedies flashed out in my mind, and I thought of prescribing it. Let me see what happens. I'll then repertorize the case. I started to prescribe that case. Okay, the prescription was actually aurum metallicum. Actually, the patient comes with a picture of aurum metallicum. The patient is hot and she is long necked. Because of that, I have changed the remedy to aurum iode. This was the keen observation of me in my clinical practice. After this, aurum iode 200 single dose, here for 15 days. This is actually after 1 month. 1 month, the varicose ulcer started to heal. The discharge is completely disappeared. There is no discharge. See the thickness of the leg. There is some blackish discoloration. It's okay, fine. I have continued the treatment. This is after 3 to 4 months of treatment. I have prescribed only single dose of aurum iode for the first time. After 2 months, I have prescribed 1 more dose of aurum iode, 200. This is the aurum picture. Exactly the aurum picture. After detail of case taking, the aurum was flashed in my mind like something. Yeah, this is a case of aurum. Because of thermals and long neck, I have prescribed iodum. So aurum iode. Okay. After that varicose ulcer case, this is a very simple, and we have treated a lot of cases, but it's very interesting. A case of sebaceous cyst. Also, it is called as Vents. As we all know that. This is a picture of sebaceous cyst. A male aged about 60 years was presented the swelling over the nape of the neck since 3 years. Since 3 years, he was having this problem. Pain in the right shoulder. Also, since 3 months. And the movement of the shoulder was restricted. While case taking, the movement restriction is very, very important. If there is any shoulder pain, if the movement is restricted or not, we should ask. A minor surgery was advised from the surgeon for the sebaceous cyst. Thermally, the patient is hot. So this was the first picture of the sebaceous cyst. I've gone for the repertory this time. Sebaceous cyst, vents. Also, pain, shoulders, especially right shoulder, and indurations tissues. Yes, the coming out remedy is calcarea carb. The patient is thermally hot. What can we do now? Yes, the indicated remedy is calcarea. Patient is thermally hot, and also there is movement is restricted of the right shoulder. So the prescription was calcarea floor 30, 2 doses in 15 days. A lower potency, it can be repeated. So weekly 1 dose for 15 days, 2 doses. Calcarea floor 30. After that, after 1 month, sebaceous cyst disappeared. The right shoulder pain was also reduced with non-restricted movements. Again, there is no restrictions. This is the photograph after treatment from calcarea floor 30. The sebaceous cyst is completely disappeared. So this is the importance of totality of symptoms in pathological cases. Yes, next move on to the fourth case, which is very, very complicated, having deep pathological symptoms. And this case proves the very much scope of homeopathic treatment in deep pathological cases. And we can get some hint in managing these kind of pathological cases in our clinical practices. It's a case of EPN. What is EPN? It is emphysematous pyelonephritis. This kind of cases is actually very rare in my clinical practice. Actually, this was my first case in treating this emphysematous pyelonephritis. This is the picture of emphysematous pyelonephritis. The kidney will become like this in this condition. Completely cessation of functions. There is some introduction to this. The cause of mortality in emphysematous pyelonephritis is due to septic complications. We should be very alert and we should be very quick in considering the symptoms and indicating the remedy. Otherwise, the case will go wrong. EPN, there are classes of EPN actually. This case was class 2. What I am treating is emphysematous pyelonephritis class 2. I have shown these classifications. In EPN class 1, the gas in the collecting system is considered as EPN class 1. What I am showing today is class 2 EPN. That is gas in the renal parenchyma without extension of the extrarenal space. This was the case. What about class 3? A, extension of gas or abscess to the perinephric space. Class 3B, extension of gas to pararenal space. These are all the classifications of EPN. Class 1, 2, 3A, 3B. Class 4 is solitary kidney with emphysematous pyelonephritis. See, these are the classes which are classified. See, 95% of the cases with emphysematous pyelonephritis having underlying uncontrolled diabetes mellitus. The risk of developing EPN secondary to urinary tract obstruction is about 25 to 40%. This is what the exact case is. The patient came up with the EPN having some obstructing calculi. That is the beauty of the pathology. See, this was the case which was presented to me in my clinic. A male is about 56 years, by profession is a carpenter, was present with the symptoms of renal failure since 15 days. They don't know exactly what the EPN is. They simply said, sir, ಎರಡು kidney failure ಆಗಿದೆ. That's what they said. Kidney ಹೋಗ್ಬಿಟ್ಟಿದೆ, they said. In our Kannada language, they say kidney ಹೋಗ್ಬಿಟ್ಟಿದೆ, gone, kidney is gone. What they said. Early, the patient was diagnosed with renal calculi and showed to a local doctor and advised scan. Then they have consulted nephrologist in the corporate hospital. They have given no hope. And they said he may succumb in few days. What's the verdict? Patient came back to home. Patient came back to home because there is no use in treating there. They asked to pay some lakhs of rupees. If there is a chance, we'll help him out to survive. Otherwise, there is no chance. So they decided to get him back. No need to go for a surgery or any kind of treatment there. The patient was having severe weakness without any appetite. The patient was so much prostrated, he was not able to talk or walk alone. This was his condition. When he came to me, 2 people accompanying him was carried in their shoulders to my clinic. He was not able to speak properly. He was not able to see face to face properly. When I asked something, only he would say, that's all. Only 2 words. If I ask something, If it is nothing, only this much. This was the condition of the patient. Past history. History of CABG 8 years back. He was under tablets for this. History of appendicectomy 5 years back. And there is a history of insulin-dependent diabetes mellitus since 3 years. He was taking insulin since 3 years. Along with that also, the blood sugar level was very high. Personal history, basically is a vegetarian. Appetite was absolutely no, decreased. Hunger was decreased. Desire for spicy food. Thirsty. Bowels was constipated. Bladder only 2 times per day, 0 and night. The urine output was also very much reduced because of suggestion of function of kidneys. Sweat was very, very less. Sleep was good only due to severe weakness. Only thing you used to do is you used to sleep. That's all. There is no activity at all. No walking, no talking, no sitting. Only sleeping. Thermally, the patient is hot. These are all the conditions which are explained by her, by the patient's guardians. On examination, no edema anywhere in the body, though it's a case of renal failure. Is it important for homeopaths? There is no edema all through the body, although it's a case of renal failure. Usually in renal failure cases, there will be some edema under the eyelids or in the face, the puffiness of the face, or in the legs, the puffiness of the legs. We'll see a lot of cases. But in this case, there was no edema. The BP was 90/50 mm of ST. Face was very, very pale, severe weakness, not able to walk and talk. The patient was carried by the family members to the clinic. And he was presented with these reports. First report he presented to me is this. Can you see this? The random glucose level is 288 after taking insulin. Serum urea is 150. See the creatinine level, which is 4.5 with emphysematous pyelonephritis. See the electrolytes. There is an imbalance in the electrolytes. Sodium is 123. Calcium is 0.88. This was the first report which was presented to me. And also hemoglobin is 9.2. Total count is 26,400. It's also raised. Platelet count is 1.3. See the pus cells in the urine, 150 to 200. This was the condition. Albumin is present. Bacteria are present. Can we take up this case in the clinic, or shall we send to the other hospital? No need to treat in homeopathy. Also, the scanning report. Enlarged left kidney with intraparenchymal gas in the lower pole, pelvic calcial system with perinephritic standing as described. Features of left-sided emphysematous pyelonephritis, class 2. This was his echocardiography report. See the EF, 35%. This is the reason why the patient was sent back from the corporate hospital, because at this EF rate, they can't do any kind of dialysis. This becomes positive to the patient to take homeopathic treatment. Otherwise, they would have, if the EF was above 50%, they would have started dialysis. Definitely he was in a dialysis. If this was right, only if is 35%. They also given no hope for this. If you start dialysis, he may succumb in the table itself. So after considering the case, this was the repatriation chart. The patient was actually unconscious. He was in stupor, and he was when he goes to sleep, deep sleep, he starts snoring, and sleeplessness is the slightest aggravation. Being that also, if there is any noise, the patient used to get alertness, and he is constipated. So at this kind of situation, the patient is in tertiary care. Opium and sulfur comes very close, very, very close. But I think there is no symptoms of sulfur here. I have given him opium 200, one single dose. Only single dose, that says. After that, it's very, very important. Another remedy which is indicated, as I said, there is no edema, though in a case, it's a case of renal failure. What is the remedy? Only one remedy in the whole of the Materia Medica, that is serum angulae or eel serum. It is called as eel serum. This is the only remedy which covers all the three pathology. It covers kidney, it covers heart, and also covers pancreas. All the three, in this case, all the three are affected. The heart function is very, very less. EF is only 35%. He is on insulin, and kidneys are not functioning well. This is the only remedy which covers all the three pathology. Serum angulae or eel serum. This was prescribed in 30 potency as a daily dose. Here the frequent repetition is required for this case. After 1 month, to my astonishment, he came himself to the clinic, sat in front of me, reporting this report. Serum creatinine level is 1.6, which was 4.58 the earlier. Blood urea was 62.2. It was 150 in the first report. Now the blood urea is 62.4. So what next? After this, this is very, very important. After the first prescription, second prescription becomes very, very important. So after that, I continued same opium only 1 dose and eel serum 30 for daily dose. After that, see the echocardiography report. Normal LV cavity and systolic function. Hypokinetic anterior wall, old MI. Let me see the EF. Now EF is 60%. So this is very, very astonishing to me. Actually, I was also very astonished after he sat in front of me after a month. See the hemoglobin report, which is 12.4. Total count 8,600 cells. Neutrophils, lymphocytes all became to normal. Platelet count, ESR is 62. Still there is an infection. Absolute eosinophil count 258. See the CT scan here. Now there is only emphysematous cystitis. Emphysematous pyelonephritis is gone now. See the beauty of miasm, the miasmatic travel. When he came to me, he was in syphilitic stage. Now it has shifted. See the emphysematous, only cystitis is there. It has coming towards Sora. See that miasmatic travel after prescribing the right remedy. There is a moderate hydronephrosis with an obstructive calculus in the PU junction. Because of that obstructing calculus, the kidney has become infected and stopped functioning. But some obstructing calculus is still present. This is very, very important. The case is not complete yet. After that, the urine albumin is 2+, sugar is nil. Pus cells It was 150 to 200. Now it has reduced, but some plenty is there. That's all. The homeopathic treatment continued as the patient was advised to stop insulin because after the prescription of yield serum, in spite of taking insulin, the sugar used to be always high in spite of taking insulin, about 250, 300, sometimes 350. After prescription of yield serum, it has reduced. In some day, the patient said, "Sir, it was only 90, it was only 70." Becoming hypoglycemic after taking yield serum. So he stopped. Actually, before my advice only, the patient, he stopped the insulin himself. And he came to me with the reports. It was absolutely normal. After a few months, see the report. Actually, this was the latest July report. The serum creatinine level is almost normal. It is 1.5. He started his daily routine activities. Being a carpenter by his profession, he started to do his routine work absolutely fit and fine. And also the report, there is a small left PUJ calculus obstructing, causing moderate hydronephrosis with pyelonephrosis. Again, this is also a mathematic journey. It is coming towards soda. So this is a very beautiful case. Now the patient is healthy and he's started his carpentry work in few months after homeopathic treatment. And he became the talk of the town in his area. All the neighbor and his friends and relatives, they are all coming to see him. What is this? What is this? What happened to you? Now you are in a deathbed. How did you survive? Who was the doctor who treated you? Like that. He was the talk of the town at the time. The treatment has been continued to eliminate this PUJ calculus. Patient is doing fine. And this case become a myth buster in saying that homeopaths can't treat critically ill patients. No, we have the scope. Homeopaths have the scope to treat critically ill patients also. So we have to consider the totality, pathology, which is very, very important in these kind of cases. Note, this patient was treated exclusively with homeopathic medicines without any dialysis or any other form of treatment. Only thing is, he was taking some tablet of, only one single tablet of heart, which is rated. I think he was in episprin, that's all. Otherwise, no other medications. He was treated exclusively with homeopathic treatment. So, let's move on to this another case of cortical vein thrombosis. I think this is my last case for this today's session. This is also a very interesting case. Cortical vein thrombosis. As we all know that the cortical vein is here. A female aged about 35 years was presented with severe form of headache, especially left-sided headache, after 12 days of delivery. As per the doctor's advice, they underwent for investigations, MRI, brain. According to the MRI, it was diagnosed as cortical vein thrombosis. The patient presented with the symptoms of left-sided headache, constant pain. She was having constant pain. There is no relief at all. And aggravating lying down with heaviness of the eyes. There is no sleep at all due to the pain. The patient was advised the allopathic line of treatment with steroids and blood thinners. But patient was willing to take the homeopathic treatment. She has got the homeopathic background. So she was willing to take homeopathic treatment. So she called me according to this. And he posted me this scanning report. MRI, brain, which suggests focal gyral hyperintense signal noted involving left hypocentral gyrus, suspicious hyperintense cortical vein noted adjacent to the above hyperintensity. It's a cortical vein thrombosis. So, according to the totality, I have repertorized the case. It's a syphilitic case. We should select a remedy of fast acting. It should be very fast. That is thrombosis, blood and blood vessels. That includes that. Left-sided headache especially, which is lying down aggravation. These are the characteristic symptoms. So the remedy coming up is lachesis and epis, Rs, natrium sulfate. The symptoms covered is lachesis. The totality is 5. And also, it's a syphilitic case. So I should think of some syphilitic remedy, which has to act very fast. So this is the picture of Surukuku snake, lachesis 200, lachesis muta, 202 doses in 15 days. Just after 15 days, she went for a scan. She got relieved within 2 to 3 days. Within 3 days, she got relieved. Headache completely disappeared. There is no aggravation lying down. Patient is well. There is no single episode of headache in 15 days. She went for a normal scan. This is the impression of MRI brain after 15 days. Normal MRI brain study. This is the potential of right homeopathic treatment and the right miasmatic choice of the remedy in pathological cases. So I would like to thank you one and all for this wonderful session today, which has IFPH has given to me this opportunity tonight. Thank you one and all.